Thank you everyone for joining us this evening. You have joined our session on improving patient care through sending consults to Netcare. Hopefully you're all familiar with using Zoom, but if you're having technical troubles, the 1-800 number is up on the screen for you to call. Next slide, please. We are recording today's session. By participating in today's session, that you understand and consent to this webinar being made publicly available via link on the AMA website for an undetermined length of time. That includes your participation in the chat. That might also be recorded and made available after the fact. Next slide, please. We'd like to recognize that we are webcasting from and to many parts of Alberta today. The province of Alberta is located on Treaty 6, Treaty 7, and Treaty 8 territory and is a traditional meeting ground and home for many Indigenous people. Next slide, please. Today's presenters, Dr. Neil Cooper, community-based pediatrician, also sports medicine physician and past president of the Alberta Medical Association. We also have Dr. Scott Wilson, community-based neurologist, president of the section of neurology with the AMA and a member of the AMA Informatics Committee. We're also joined by several members of the AMA Accelerating Change Transformation team. Myself, my name is Jillian Bates. I'm the lead for CII for Community Specialists, and Barb McCaffrey, who's the provincial project lead. And we have several team members participating in the chat today. Next slide, please. So what are we going to accomplish today? Dr. Wilson and Dr. Cooper are going to share their experience of participating in community information integration to share their consults to Netcare and how that's impacted patients in their practice. We'll have a quick conversation of how we have this amazing team at the AMA, the Accelerating Change Transformation team, to help support you in getting more information and getting yourself or your clinic signed up with CII. And then we have 10 or 15 minutes, although we're happy to go as long as we need to, for a great question and answer period. During the session, you're welcome to write questions in the chat, and then we'll have an open Q&A at the end where you're welcome to come off mic and ask any questions you might have. Next slide, please. So before I hand over to Dr. Scott Wilson, who's going to start us off, I just wanted to launch a quick poll for those of you that are on here. If you don't mind sharing with us what EMR you're using in your practice. So if you're a specialty care physician, what EMR do you use in your community-based practice? That just helps us answer some of the questions and frame some of it up. And Scott and Neil will share what EMRs they're using, but we have a team that knows the different EMRs and can help you with that. Antonia, can you just put up the results of the poll, please? And then we'll hand over to Scott.
It looks like MedAccess wins, or the TELUS products. Close second, Healthquest, and nobody from QHR, it looks like. So not quite a home run.
Scott, I'll thank you. We'll hand it over to you to tell us a little bit more about CII.
Thank you, Jillian, and thanks to the ACTT team and Barb, as well as I see our incoming president, Madam President, soon to be Fred is here as well. Anyway, to everybody and fellow colleagues. So I've been tried to be an IT leader and practice what I preach. Maybe can we take down the poll? Well, anyway, I think so a couple of years ago, it was recognized that we wanted to try and get community consultations into Netcare, and it did take some government money to give to the vendors to conform to certain things. So what you see here is the kind of workflow diagrammatically represented. So the community physician on one of the EMRs that are conformed, which includes Accuro, Healthquest, and the TELUS suite, MedAccess, PS suite, and Wolf. Once you toggle whatever in your electronic medical record, we have a demonstration, I have a screenshot of that in my EMR. It goes up to the CI Data Hub, and then that is pushed up to Netcare. So if I do a consultation letter, then after it's been proofread and faxed off, then myself or somebody else will actually, say send to Netcare, and then that goes up to Netcare later that night. It's about a 24-hour turnaround. So sometimes when I'm on call, I'll actually dictate a letter, a quick note, even if like a telephone consult, I can send that up to Netcare, or of course my consults. The whole idea is that hopefully this is for better patient care. So what you see here on the right side of the diagram is where where this goes in the tree. We have another, and when you hover over this, you can see this is one of Dr. Cooper's consults. You hover over it, it says what the source is. Oh yeah. And it's a consultation and what it is and where it came from. So, and then if you were to click on that, you would actually get the report, which we'll demonstrate a little bit of next. So next slide. In Healthquest, which I use, it's really as simple as there's one button that says send to Netcare. So you can send this to Netcare. Now, as physicians, a lot of people have been worried about confidentiality. So you have the choice with your patient as to whether you want to send this to Netcare. I find most patients, it's a no-brainer. They don't really, they're not really concerned about it. If they are, then we won't send it. If you send it to Netcare, you can take it down from Netcare as well. There is a process for that. So once I've done a consult letter or whatever letter or correspondence, I can send this up to Netcare. Next slide, please. So this is just a blow up of what you would see if you click on the consultations. So because I work in AHS facilities as well as work in, well, primarily in my community office, when I do a consultation, what you're seeing here, this is a real live screenshot from some of my consultations that were uploaded for a patient. Now, if another community provider did a consultation at one of the other neurology clinics, it would come up like this and you could hover over it and see different care providers and what they've done. Similarly for the outpatient consultation. So, I mean, I always look at this for a lot of my consultations in terms of, especially if I'm talking to the patient and they've said, oh, I saw another neurologist 2 years ago. So I will definitely go into Netcare and look for any consultation letters that I may not have in the referral. Next slide. So you can see here, this is just a screenshot of one of my consult letters. So it actually takes the whole letter, the letterhead, everything, and as a PDF, and it is uploaded into Netcare. So this is just a screenshot to demonstrate that. So whatever you have as your own brand, I guess, that is what goes up to Netcare. Next slide. So, we've all, well, I've certainly been on call and, get a call saying, well, their neurologist is in the community and they have, let's say, seizures or MS, and what would you do with this? And I can tell you it's a lot simpler if you can quickly look on Netcare and get further information. So I'm certainly using it. I know my other colleagues are using it, but also, I've had calls from the emergency department, and there may be a patient that I haven't seen for a couple of years, and the patient would like to come back and see me, or they're there for a similar problem or maybe a different problem. And then I am getting calls from the emergency physicians to provide a repeat consultation. So one case that comes to mind, I have a patient with a rare neurological movement disorder called stiff person syndrome, and recently had a flare up. And the emerge doc was able to go look at my consults, understand the treatment plan and what was going to happen. And he did have multiple in and outs of emerge, but it really made things much more seamless in terms of the consult, in terms of the management plan of the patient. And we avoided admission, although eventually he did need some further more intensive neurological therapy. So this is happening. The reality is that a huge amount of care is taking place in the community, and this allows for better patient care overall and better communication, patient-centered information to flow in a timely manner, especially for urgent care and the emergency physicians. So next slide. One of the questions that we've always had asked is, well, what do you put up to Netcare? Why do you put this up or that? So obviously, most of my major consultations will go up. Now, I see a lot of repeat follow-ups for things like Botox. So that kind of a visit, I won't necessarily post a consult note up to Netcare, but the way I deal with it is if I make a management change of the patient with a medication or some sort of therapy, or recommend some sort of course of action, and I think that is pertinent or germane to the patient's care, then and especially if I've usually sent a letter back to the family physician, then I upload those to Netcare. But again, it's at my discretion. So I haven't found, ultimately, I think it's worked out better all the way along to have that information available. So anyway, very flexible, very easy to use. Once you get going, super simple. Next slide. So I'll pass off to Neil now. He's going to demonstrate some of the similar or demonstrate some more information about the project.
Thanks, Scott. Thanks to the ACT team for inviting us to be part of this thing. So yeah, so we've been using sending our consults up to Netcare in our clinic since about December. And so I was going to just sort of let you know a little bit about what's been happening with that. So in Practice Solutions, there's a box to click. It's in when you select an address for where your letter is going to, you can select this eligible for encountered data extract, and that will send it up to Netcare. So now you can make a list using your CC, and then one of the people you're sending it to is to Netcare. So next slide, please. As Scott showed, then it shows up in Netcare under consultations, and here's one of mine. And this is what happens if you hover over the patients or over that consult. And some patients, there might be many of these, but you can hover over it and see who it's from. And then the next slide. Key point with this is when you click on this one, it is a PDF of my letter. So it's exactly the same as the letter I sent to the family doc. Includes my header and letterhead and all that, and also includes my signature at the bottom. So it looks exactly like the letter that I would send. Next slide, please. So I wanted to talk a little bit about what does this do for patient care? How does this help us, or how does this help your patient? So Scott mentioned, but the majority of care of a patient actually occurs in the community. So where up until now, the majority of Netcare was built from encounters in acute care. And so there's a big gap there. One of the things that's about that is that when I do a consult on a patient, it's not shared broadly. I would send it out to the family doc or to the referring doc, or if those are two different people, we might send it out to two different places, but those are the only people that get to see the consultation. And if a patient comes in later and has an issue, it comes into acute care or into somebody else who hasn't seen them, the fact that my letter wasn't shared broadly doesn't help the patient at all that way. So many of the family doctors who look after these patients, especially if they're not part of the same clinic that got the original report, they're not getting copies of what I'm sending either, or what my plans are. We had a lot of frustration with patients of ours who we were seeing frequently, or who were our primary care patients, going into hospital, and the people in the hospital wouldn't know that we were involved in their care. And so not only did they not know what we had planned for the patient, but they didn't even know to contact us. So, and the interesting thing, when kids go into hospital, they're asked who their family doctor is. They're not asked who their pediatrician is. In fact, all the hospital-based EMRs only had one slot. They didn't have a slot for a primary care pediatrician and a primary care family doctor. So, so not finding out that we were involved in the patient was a real frustration for us. So, last thing is that this is kind of a marketing tool for us, right? So if I do a good job on my patients and I'm producing good product with my notes and everything, and the people who are about to refer to a pediatrician, if they remember that they saw one of mine and thought I did a good job on that, then they can remember to send that next one to me. So I look at it as a marketing tool a little bit as well. I wanted to tell a little story about a patient of mine that came into hospital. This is one of my, I have a pile of these teenage autistic kids who, once they get bigger than their moms, start getting violent and start pushing back when they want things. And so I had seen the patient over several times and had kind of mapped out a plan for, we're going to try this. If that doesn't work, we're going to try this. If that doesn't work. Often these kids, when they get really difficult, will end up in the emergency department. And I had the emerg doc phone me and say, I've seen the child, I've seen your note, I've seen what the plan is, and I'm going to carry on with the next step in your plan. And so that was a real sort of validation of how this system works and could make things a lot better for that patient. So they didn't have to start over again and get referred somewhere else and everything. So it was quite a good example of how that really helped with the patient's journey. Next slide, please. There are two other parts to community information integration that we haven't mentioned yet. So we've concentrated on the consult notes going to Netcare, or the letters going to Netcare. I should just back up before I go on to this next one. I send most of my initial referrals, the initial consultation letters, And then if I make any change in the patient's plan or anything, then I'll send that letter up. I get to choose every time when I create a letter, I get to choose and decide what's going up. So we have complete control over that. So when we, there's two other pieces to this, to the community information integration that we haven't mentioned yet. One is the Community Encounter Digest. And it's a running 1 year kind of summary of the patient's experience in the system. And you can see the top part of this thing is called the Community Encounters. So every time a patient, this is optional for us as specialists. So the primary care doctors would do it, and it would be, and you can see on this list, most of these are primary care physicians, but as specialists, we have the option to also contribute to this Community Encounter Digest. It includes just the encounter date, the location, so the clinic name, the provider or the physician that saw them, the reason for the encounter that comes out of sort of your scheduler, and then your encounter assessment and what you've decided. So that those are the key points. So if I see a patient with wheezing and coughing, and I think they had asthma, then those would be those two things, and it would document that. And it's a running 1 year total. It goes over that year. There's also, it summarizes your problem list, or the primary doc's private problem list, and those are all added together. Any allergies, and it also includes things like height, weight, blood pressure, and the waist circumference are the ones that they're tracking for now. And then any referrals you make through your system are also included in that. So it gives us sort of a one-page summary to the person that's looking at it, to see what that that summary. This is optional for specialists to be able to add this, so you get to decide whether or not you want to be part of it. Once you sign on to it, then all of your notes go up, or all of this information goes up on every one of your visits. So, and then next slide, please. And then the last piece of the we haven't mentioned yet is really only for, among specialists, is only for pediatricians. It's essentially for people who are doing primary care. So all the primary care docs plus pediatricians who do primary care. It sort of gives us another level within Netcare of recognition in those patients where I'm the quarterback for that patient or the primary care doc. So in that case, I'll receive notices from when the patient goes into the emerge or goes into day surgery. So any of those sort of notices that come out of Netcare, I get those ones. And then starting in June, Netcare will actually display me as the primary care doc for that patient. And so pediatricians, depending on where you are in the province, some have way more than others, but have some degree of primary care that they would look after and would take that on. So next slide, please. Okay, that's it. So now we're going to hand over to Barb and tell you how you can get involved too.
So if you are interested in participating in community information integration and sending your consult reports to Netcare, the Accelerating Change Transformation team at the AMA is here to support you. You can contact us by email, and we'll put that address in the chat if you want to contact us. As well, we do have a very comprehensive website that you can access. And if you scan that QR code on the screen with your phone, you will get right access to that. But in addition to that, we have a team that's available to support specialist offices and or pediatrician offices if you're interested in participating. We do want to thank especially Dr. Wilson and Dr. Cooper for their time this afternoon. And giving their time. We aren't going to shut you down. If you do want to stay on for some Q&A and speak to Dr. Wilson or Dr. Cooper, please stay on. But we did want to thank everyone for their participation, and thanks Gillian as well for getting us going.